everybody. Welcome to this month's episode of Elevánt Wealth. My name is Dan King. My partner Brian Scott's on here with us as well. Very excited to meet with you today. It's been a very busy summer for us, and I'm sure for each of you. But we did want to point out a birthday that happened yesterday that's quite important to our topic today. Yesterday was the 89th birthday, August 14th, of Social Security. So many of us are always looking forward to that. When we can retire, what Social Security might look like for us. So what we want to do today is address that and also go into a little bit about Medicare. So in order to get started on that, use your time wisely, we're going to turn the time over to Brian Scott.
All right. Social Security is a super fun topic for me. It's one of the ones that, or one of the things that I kind of became an expert at first in reference to our path to being retirement transition experts, because there were so many questions about the program. And something else I learned about the program as we helped clients go through this process is how important it is to get these questions right. When and how to file for Social Security retirement, nailing your decisions surrounding Social Security Medicare. And so August 14th, was it 1935, Dan? I think was the birthday of Social Security program, and we're celebrating that today by talking about it. So
that's correct. Yeah.
So I'm going to share my screen here really quick and just go through a few slides of a class that I've taught in the past about Social Security. And I want to start, we're not going to do the entire thing, but I just want to hit a couple of highlights that that really, I guess, nail the things we need to get right surrounding the Social Security program. Can you guys see that okay? Did it pop up? Okay, perfect. So the number one thing is when I talk to people, if I have 3 minutes to talk to somebody about Social Security, I will always talk about the 5 things to consider. Now, the interesting thing about this is that this is different for everybody. Everybody's age is a little bit different. Their marital status, not just their current marital status, but their past marital status as well. Their health, the way they see the world, and testing your strategy against your financial plan. So let's talk about each one. So age is pretty obvious. How old are you? What year were you born? How old are you? All those things matter in reference to the Social Security program. And we'll get into that a little bit more later. Your marital status. Have you ever been divorced? Have you ever been married and widowed? Are you currently married? Are you currently single? All these things matter in the Social Security program. What does your health look like? Specifically for Social Security retirement, you can start drawing at age 62. Well, for an extreme situation, if you've been given a year to live, you're not going to wait till you're 70 to take Social Security. Your health would dictate when it would make sense for you to take it, right? And so we want to look at your health. The way you see the world. If you're of the mindset that no matter what statistics say or what the potential plan is to quote unquote fix the program, that you just are fearful for it not being there in the future, and you can't sleep at night because of it. Well, maybe there's some benefit to you taking it that's non-monetary, right? So the way you see the world should be factored in how you take Social Security. And then finally, by far the most important one, in our view, is to test your strategy against your comprehensive plan. We've had a lot of situations where we will mathematically solve for the best strategy, but then looking at it compared to your plan, where you're looking at your other income streams, your other investments, your other pension money, other things that way, then the recommendations actually will completely change just because we're looking at everything holistically. And so that's a great one to have at the end there, because it kind of brings everything together, is saying, hey, this isn't a mathematical question. It's a piece to an overall puzzle that we need to get figured out. So in reference to, it's got a giant delay on it for me. There we go. So a couple highlights I wanted to give on the program is that the importance of working at least 35 years. Now, I say this not to say if you only have 20 years that you have to work till you're 75 to get 35 years. That's not what I'm saying. But if you look at your work history and you've worked 34 years, there could be some value to adding one more year. And the reason why is that they take the last 35 years, or excuse me, the highest 35 years of work history adjusted for inflation, and they count that towards your benefit. That's what they're using to calculate your benefit. And so if you have any zeros in that 35 years of work history, we've all seen what it looks like to average zeros into an overall calculation. This is an example of an average salary of 50,000 over 35 years. If you average 10 zeros in there, it actually takes the average down from 50 to 35,000. So if you've got some zeros in there that you need to replace, that is something that can affect your benefit overall. Just something to be aware of if you're close and can add a few more years to your overall time. Another thing to know is just what is your quote unquote full retirement age. So this is what it is here. So look at the graph. This is something that's uniquely yours, and determine what is your full retirement age. Now, what your full retirement age does not dictate when you have to take your benefit. It just is a line in the sand that they use to calculate different ideas with. You can really take your benefit anytime between early retirement at age 62 and age 70. So anytime in that window, you can draw this benefit. And when and how you should file, looking at yourself and or your spouse if you're married, when and how the two of you should file is a very unique decision that can be come to with planning and really looking at everything that you have going on. But generally speaking, the earlier you take it, the lower the amount. The higher you take it, the later you take it, the bigger the amount. So an example of a full retirement age of age 67 with a benefit of 1543, if they drew early, would only get 1,081. If they drew late, they might get 1913. And so usually the question we get at this point is, well, what's the break even? Because we're getting it for longer, but we're getting less if we draw early. Usually it's around age 82 to 83 for most people. And so if we want to plan against longevity, living into our 80s, 90s, even late 90s, perhaps having one of the two of a married couple delay could make sense. But there's so many factors to consider. Again, this is not a mathematical question. It's one little piece to an overall puzzle that we need to figure out. One other thing to keep in mind is that your Social Security benefit will adjust with inflation. Now, this graph needs updated because we've had some very high adjustments for inflation the last couple of years. 22 and 23 had, I want to say it was 8 or 9% in 2022, and 2023 was 5 or 6%. Very strong adjustments to Social Security in the last couple of years to kind of help us keep up with inflation. And the reason I flashed this screen is to remind you that I'm actually hid the wrong slide here. This one here, let me unhide this. That don't think of Social Security as just an income stream or a deposit that you're going to get each month. The reason this is so powerful and why it needs to be really considered and have a really good decision made here is that it is a lifetime inflation adjusted income stream. In other words, it's guaranteed for your lifetime and it increases with inflation. There's very few income streams that are guaranteed for life and increase each year. And so the power of this in your overall plan, if it's harnessed correctly, can be really life-changing overall to your plan. So too important for guesswork, too important to borrow the answer from your neighbor or your coworker. And so getting with us to really talk through the details of your Social Security strategy and how that folds into your overall plan is incredibly important to your retirement strategy. So again, we don't have time to dive into all the intricacies of the Social Security program today, but needless to say, we're here to help. And so if we can be of any assistance there, please reach out and let us talk through your situation and talk from a planning perspective as to what the best strategy for you would be. So now, as we advertise this webinar, we talked about Social Security. I think most people, when they think about Social Security, they think about Social Security retirement. They think about that income that they're going to get. But funny enough, the Social Security program also includes Medicare, which is a huge part of your overall financial plan. In fact, when we look at our financial freedom framework, your income plan includes your Social Security, but also your healthcare plan is one of the pillars. We've got to talk about it. And thankfully, the Social Security program has provided some healthcare benefits that I believe it's important for us to understand as we go into retirement. And so we brought David Wilcox, who is just the expert in Social Security planning, and has dedicated his entire life in a very specialized way. In other words, he only does this type of work to get really, really good at this program. And so we brought him on to kind of have him give us kind of a little bit of an overview of what things that we should be aware of coming into retirement and how that program works. So David, I'm going to shoot it over to you. I'm going to stop sharing my screen and let you kind of take over.
Perfect. Okay, thank you, Dan, for that introduction. Can you see my screen okay? Can you see not my face, but Medicare Made Easy? Is that right? Good. How to navigate Medicare without all the stress. Highlight overview. Thank you. If we're celebrating birthdays and Social Security is the oldest, then Medicare is the baby brother. 1965. Medicare was passed into law in July. So I thought I'd start with an appropriate introduction. Meet your presenter, Chris Hemsworth, ruggedly handsome, Hollywood trained, sexiest man alive, voted by People magazine. Not available for today's presentation. So sorry. David Wilcox from Magic Valley Insurance was available for today's presentation. Brian's right. I do spend a lot of my time just specialized focus on Medicare and health insurance, knowing those options inside and out so that when you need our help, you have someone that knows those options inside and out, including multiple trips to Washington, D.C. to personally visiting with every Idaho senator and legislator relative to things that affect Idahoans, people here in Idaho about the Medicare program. So what is Medicare? Highlight overview. Medicare's health insurance. Medicare is a federal government health insurance program. It's designed to help you pay the high costs of medical care, whether you go to St. Luke's, St. Al's, North Canyon, Minidoka Memorial, Cassia Regional, Huntsman, Mayo Clinic. You will have some medical bills you do not want to pay on your own. Thank goodness for the Medicare health insurance program to help pay some of those bills. Typically, you don't become eligible for Medicare until age 65, which is different from when you can become eligible for your Social Security retirement income as young as age 62. Exceptions to that age 65 rule for Medicare include people with certain disabilities. So you may come see me. I've got someone on Medicare who's 21 years old. So usually if you get Medicare younger than age 65, you've been through some hard things. So question is, when do I need to start worrying about Medicare? My advice for you would be, please don't worry about Medicare. A good broker or advisor can help you navigate all of your Medicare options. Typically, you want to start planning or having that conversation about Medicare 3 months before you turn age 65. Or if you continue working past age 65, up to 3 months before you leave your other coverage. Whether you've started your Social Security income or not does affect how you enroll in the Medicare program. We can go into those details on a case-by-case basis. I love talking about Medicare, so if questions come up, feel free to interrupt me or email into Elevánt Wealth. A common question is, David, do I need Medicare if I have other coverage? I have VA, military, TRICARE. I'm still at work. I have great coverage at Chobani. I'm on my spouse's coverage to the College of Southern Idaho. Do I need Medicare if I have other coverage? The bottom bullet there says, is it okay not to enroll in Medicare? One of my favorite conversations to have with people is when they come in approaching age 65, they're eligible for this Medicare federal government health insurance program, and we find out that they don't need it. And I love telling them, you don't need it right now. Come and see me when you're 67 or 72 or 89. When your circumstance requires that you need it, come see me. I like turning people away because they know we're there to take care of them when they need the coverage. So generally, you almost always want Medicare. It's almost always better health insurance than your employer provided plan. It's almost always less expensive than other alternative options. But when it's not, you need somebody to tell you, hey, stick with that other program first. Come see me later in life too. Lots of scenarios when it's okay to delay Medicare. If you do it right, you will not be penalized. If you do it wrong, Medicare loves to hand out lifetime late enrollment penalties for people that navigate it wrong. So um, it leads into my slide here, choosing a good Medicare advisor. Why use an agent or broker? Why not just go to YouTube University? What about the advice I'm getting from Joe Namath and JJ Walker and William Shatner and all these famous TV celebrities? Commercials are hitting you just incessantly, and they're going to ramp up. We're approaching the time of year Medicare commercials just hit a fever pitch. Can't I just do all this myself? The answer is yes. Good luck, and you could hit a home run, or you could be saddled with some lifetime penalties by doing it just slightly wrong. Most Medicare advisors charge no fee. We are paid by the Medicare approved insurance companies to help you navigate your Medicare options. It's kind of a win-win. You have somebody that swims in these waters, and there's no cost, and it doesn't affect your plan or your coverage or your price, that somebody's hand holding you through this process. To give you a perspective, I did a count. I came up with over 200 different Medicare plan options available for people that live in Twin Falls County. It approaches 230, 220 Medicare options for people that live in different counties of Idaho. So you'll turn 65 once ever in your lifetime. You'll enroll in Medicare once ever. A good advisor will do that 100+ times a year with people. So let us help you navigate that. How do you pick a good advisor? Probably the same way you picked Dan King and Brian Scott and others, right? You find a comfort level with who you're dealing with. You feel like they speak your same language. You don't leave their office feeling dumb. You feel empowered. You just have a comfort level with them. You'll look for things like experience and gosh, were they referred to you by 10 of your friends that have been through that process? That's a telltale sign. So most of what I do, these next two slides are most of what I do. I have generally face-to-face meetings with people where we explain in English, we hope, the Medicare coverage choices. I like to pull the Medicare and You handbook. I love using Medicare's version of Medicare, not David's version of Medicare, not AARP's version of Medicare, not Blue Cross of Idaho's version of Medicare, but Medicare's version of Medicare will explain on a comfort level that you understand. We'll explain Medicare 101. I basically take one page out of this 200-page handbook, and we spend most of our time, 30, 40 minutes, going through this one page. And it boils down to this slide on the screen, which says, what are your Medicare coverage choices? When you first sign up for Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There are two main ways to get Medicare. There's a pathway called Original Medicare, which includes Medicare Part D drug coverage and a supplement to Medicare. You can add dental and vision benefits to that pathway. And there's a separate pathway called Medicare Advantage, or Part C of Medicare, which both pathways, you need to realize both pathways have advantages and disadvantages. There are pros and cons of going down the Original Medicare pathway. There are pros and cons about going down the Medicare Advantage pathway. And in a visit with a good advisor, you'll have those pros and cons explained to you, both pathways. My parents went on two separate pathways. I've got one of my parents that went on Original Medicare with a good supplement. That was the right pathway for that parent of mine. And the other parent went down the Medicare Advantage pathway, and that was the absolute right pathway for that one. So it's important you find what's right for you. but you're not making a lifetime decision with Medicare. That opening statement, that opening sentence says when you first enroll in Medicare and during certain times of the year, you can choose. Medicare has an annual once a year. How are you doing, right? Are you on the right plan? The plan we picked last year, is it still good for next year? Is it still competitive? Does it still fit your needs? Is there a better option? Once a year, every year, you should have an advisor reaching out to you saying, I'm comfortable with your plan. It's good and stable. Stay put. Or your hair's on fire. Get in here. We've got to fix something. So, fraud alert. I put a slide up there. Nearly every visit I visit with people turning age 65, they're getting hundreds and hundreds of solicitations, right? You're getting emails, social media outreach, Facebook messages. I've literally had people have come knock on your door and say, we can help you with Medicare. I'm going to just say, be very, very careful. Medicare never calls you unless you've scheduled an appointment. Social Security never calls you unless you've scheduled an appointment. The IRS doesn't call you unless you've scheduled an appointment. There is no plastic Medicare card or your new Medicare card with a QR code. You got to be aware people are anxious to either sell you or advise you on a Medicare plan that may or may not be appropriate, or equally, they're just anxious to get your demographic information. If I can get your name and birth date and social security number, and I can't sell you my Medicare plan, then I can sell your information to 1,000 people from Texas and Florida and the Philippines that will then call you incessantly. So look to avoid things that look like Medicare. I put on the screen the official logos of Medicare, CMS, and the Department of Health and Human Services. So just be careful there. Make sure you're dealing with a trusted advisor. I always tell people you don't have to call New York or Florida or India to get good Medicare advice for people that live here in Idaho. For sake of time, I'm just going to maybe hit a few highlights. There's a ton of stuff to talk about. Your circumstance would dictate what we talk about. For people that have a Medicare plan, Idaho has a unique law that most YouTube educators don't know about. So if you're learning all your information on YouTube about Medicare, you may not be educated unless it's an Idaho presenter about the Idaho birthday rule. In Idaho, if you have a Medicare supplement plan, you have a guaranteed 63-day window to change your plan to a more competitive insurance company without having to answer health-related questions. This is extremely valuable if you've been on a Medicare plan and that insurance company started to jack up the price and your healthiness has not allowed you to shop around in the past. That problem's been fixed. That's awesome. I'd love to talk to you about that if you're in a circumstance of you're paying too much for your Medicare plan. Probably the last thing I'm going to share on this slide, maybe last two things, is there's a phrase, IRMAA, IRMAA. IRMAA's a lady you don't want to come visit you in your house. Stands for Income Related Monthly Adjustment Amount. If your income on your tax return is higher than certain threshold numbers, then the federal government likes to charge you more for your Medicare program. Sometimes they have old data and we can appeal that surcharge and get that fixed for you. So if you feel like you're paying too much for your Medicare insurance plan or your Medicare Part B or D, fee to the federal government, visit with an advisor. They may be able to help lower that cost for you there too. So changes coming in 2025. This is probably my 28th, 29th year of advising in insurance, probably my 20th year of specializing in Medicare. And I'm going to just put out there, it's probably 2025 will probably be the most disruptive year in Medicare ever in my career. So we're seeing massive changes. If you have an advisor, technically no one's allowed to talk about 2025 products in detail until October 1st. But we've had training with every single Medicare plan in Idaho. We know what's coming, and you want to stay close to your advisor, right? There's a lot of sometimes exciting news. 4% of you will be phenomenally excited, and maybe 96% of you will be like, what the heck just happened? A lot has to do on the bottom of that slide with the Biden-Harris Inflation Reduction Act. Provisions of that law go into effect in January, heavily benefiting some people and dramatically not benefiting a lot as well.
David, is that something that that could be repealed pending the elections? I mean, elections are in November. It's set to go into effect in January. Do you see if a Republican sweep everything, just as an extreme example, that could possibly be changed, or is this pretty set in stone?
Yeah, great question. Thanks, Brian. Haven't been to Washington, D.C. more than a dozen times, even including a massive red wave sweep of everything. I don't see this being derailed on time. I just absolutely don't. This is a law that was passed in 2023. The provisions of the law have already gone into effect, some positive, some negative, and a massive provision is scheduled to go into effect in 2025. Every Medicare insurance company has reacted to that law for years. Like they've been planning it for years. So,
But just in reacting to that particular question, when would be too soon, or is there too soon for people out there to start talking to their Medicare agent? They have to wait till October 1st then, apparently, or what would you recommend?
yeah, if you're already in the Medicare program, if you're already eligible for Medicare, if you already have a plan, yeah, it would be illegal for me to tell you what the 2025 plans are until October 1st. Medicare sets very hard and specific deadlines, and good advisors are going to follow the rules, right? We're going to just say, hey, we know what's coming and we'll see you after October 1st. And if you're not yet eligible for Medicare, if you're wondering if it's right for me, then any time of year, right? Come hang out with an advisor and say, gosh, I love working at the post office and I've got insurance there. Do I have TRICARE or military coverage? Do I need anything Medicare? And on a case by case basis, we can determine that. But planning for 2025, yeah, you really can't. And honestly, we can't give good advice until some of the tools are turned on, and we can't really talk about what we know in detail. We know there's massive changes coming. There are insurance companies in Idaho that will not be offering plans next year. There's predicted 20 to 30,000 people in Idaho that will have to change your Medicare plan. Your insurance company is not going to offer your plan next year because of the effects partially of this Biden-Harris Inflation Reduction Act. So, but yeah, sorry, hands are tied until October 1st.
Sounds like it's going to be a really busy fall.
There's nothing going on here. Yeah, it's our tax season all rolled into one, right? It's just not a tax season, but it feels like, yeah,
Your
yeah.
busy time.
We love hanging out with people, though.
David, is there anything else just in closing as you wrap up that you would advise people to make sure that they're aware of and on top of?
Yeah, I might go back to this is maybe a little self-serving, but some of the things you want to look for in your advisor, we love it. I'm fine when somebody comes in my office and says, you know, I work with XYZ competitor of yours. Good advisors, we know the other good agents and advisors in the valley, right? And if you mention a name that's a competitor of mine and they're great, I'm gonna be like, that person's great. You need to go back and take that question to them. And we know those that aren't great, and we're happy to take over and say, hey, we're going to help you from here on out and make sure that doesn't happen to you again. I personally, this is biased, but there's two types of brokers out there. There's captive and independent. A captive insurance agent or broker can only really talk about one insurance company, State Farm, Blue Cross. You know, if I work as an employee for that company, I really can only tell you about the merits of the plans that one company offers. That's fantastic. It's like having a specialist that's really good in that one company. I chose to be an independent advisor, meaning we work with every single Medicare plan in Idaho, including some that they don't license with us, but we can tell you about that plan. I like when you have a broker or an independent agent that works independent. I like when you have an advisor that talks to you about both Medicare supplement plans and the merits of that route, and the Medicare Advantage program and the merits of that route. Just yesterday, I had a couple that had a great relationship with their insurance agent. They're dealing with a decent insurance agent, but they've never had both pathways explained to them. And it really hurt their feelings that, like, why was this other pathway not explained to me? I don't like when somebody only talks to you about one insurance company. I don't think that's fair to you. And I don't like it when somebody only talks to you about one of the two Medicare pathways. A lot of the TV commercials will only talk to you about Medicare Advantage. A lot of local brokers may only want to talk to you about original Medicare. In my opinion, you should learn about both and find out which is best for you. Again, my mom went on one pathway, my dad went on another, and that's okay.
I imagine if you get that, and we take this approach in financial planning as well, is if we give the client the information, then oftentimes there's a logical choice that comes from their knowledge, right? Do you find that a lot of times to where, as you explain the pros and cons, that there's a pathway that seems to lighten up as the logical one for them based on their health history, their current health, their situation?
Yeah, absolutely. I find I very rarely say this is what I recommend you do, because by the time I'm done explaining this pathway versus that pathway, the clients are empowered to make that decision. They're like, oh my gosh, why would anybody not do this route or that route? I'm like,
Yeah.
perfect. You should be empowered to make that decision and feel comfortable with that, not be arm wrestled or tricked into a pathway that may not be appropriate for you, but was for easy for an advisor to talk to you about.
Great. Well, David, thank you so very much for your insight and expertise on Medicare. We do appreciate that very much. This is David Wilcox with Magic Valley Insurance. And Brian, thank you for your brief introduction into Social Security. And just by happen to be, we do have Taylor, one of our associates, and myself are teaching through CSI a Social Security class on September 12th. So if you're interested in a little bit more detail on Social Security, that is coming up through CSI Continuing Education. Additionally, we just want to make an introduction for our next webinar. That'll be on September 15th, I believe, or thereabouts. I didn't check to see if that's a weekend or not, but it's close to that date as possible. And we're going to do another market update, take a look at that, see how things are going, and way with all the changes, the political cycle, and all those kinds of things. So I did just get a note it'll be on the 16th. So that will be a Monday, September 16th. Thank you again. And as always, we appreciate the trust that you've placed in us, and hope you have a wonderful last few weeks of the summer. Bye now.